Hi guys, welcome back to Medical Coding with Blue. Today's episode is Q&A Tuesday. This is the #1 question and answer show about medical coding, airing on Tuesdays. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. Every Tuesday, I take all the questions that I've gotten from Instagram, from direct messages, from viewer comments, and I put it all into one show. So here we go. And if you would like to have your question answered for next week's Q&A Tuesday, be sure to comment below or send me an email. And thank you to everybody who sent me a question. All right, so let's get started. All right, #1. I can't really deal with people talking so loudly about random things and basically not working. Is coding a type of career that you really need to be detailed with limited distractions so that you can work in the best capacity? Absolutely. It is the very definition of what we need as medical coders to work at our full function. You know, you want to work in an environment that is conducive to like paying attention to what you're doing. Sometimes it depends. Not all facilities are the same. I know right now with the pandemic and everything, a lot of people are working at home. Even brand new coders are working at home. But if you're a brand new coder and you're working at home, do not expect to keep that up, because once things get back to semi-normal, they are going to want you back at the facility. All right. So you are going to want to be around experienced medical coders so that you can ask a question. And now get this, I get this a lot, and I'm probably going to have to do another video about it. When it comes to remote coding, a lot of people think, oh yeah, I can do remote coding and it'll be no big deal. I've never been a coder before, but I can handle it. Guys, when it comes to book coding and real world coding, it is two different things. The book is going to give you very textbook. It's not going to try to trick you. It's going to use very basic scenarios. When it comes to being on the outside, you have to deal with doctors' colloquialisms. You have to deal with how they choose to document. And you have to be able to work with what you have in front of you. If not, you got to send a query. So there's a lot of things that go into it. And being brand new, sometimes it's not always the easiest thing to formulate even the question itself. I've had times where I had a question, I didn't know how to phrase it. And my vocabulary is pretty extensive, but if I had a hard time, I can just imagine how it is with new people. And when I was new in the beginning, I had lots of questions myself. So if you're wanting to get into this because you're thinking, well, I could be full-time at home, know that you may be at home temporarily, but they're going to expect you back at the facility. Okay, so I'm just saying. And you are going to want to be around those experienced medical coders, especially in the beginning, because it is going to be a big difference between school and the real world. I'm just saying. Next question. Can I ask what is on the test? And they're referring to the certification exams. Okay. What exactly should I be studying for? Is it all coding or are there other questions? So no one knows exactly what is on the test except for the associations themselves, because they're the ones that are administering the test. So that is the way that I can answer that one. The only thing I can recommend would be looking on the association website, whether you're going through the American Health Information Management Association or AHIMA, or the American Academy of Professional Coders or AAPC. Look on their websites and see if there's any recommended resources for studying and just go from there. There's also practice exam books for every single kind of medical coding credential you can imagine. So with that in mind, I would recommend going and getting one of those practice exam books. You can get from the year before, and that way you can just sort of practice with that. There's also coding workbooks, and I will leave a link for the coding workbook that I recommend. It gives the odd numbered answers, right? The odd number questions it'll give the answers to. So this way it'll kind of give you some practice and things like that. I recommend just reviewing everything that you possibly can and looking to see what that credential is, what that credential exam is going to be testing you on, because it does break down like this percentage is going to be of coding, this percentage is going to be of like reimbursement, and so on and so forth, privacy and things. So you would want to concentrate on studying in those areas. Always work on your speed. If you are studying for your exam, work on your speed. Get familiar with the coding manuals as much as you can, because that will save you a lot of flip-flopping. I know that a lot of people are using tabs with AAPC. AAPC is a whole thing with them, tabbing the books. With AHIMA, the tabs have had to have come with the book. So the only one that I have used that comes with the book is the AMA, the American Medical Association CPT manual, and that is the one that we can use. That is one AHIMA or AAPC allows for their CPT manual. You can only use the AMA edition, the professional edition of the CPT book, and that one comes with tabs. So when I was coming up and I took my test, I did not tab my book at all, because it was very strict back then that the books had to be clean and there could be no tabs whatsoever. So that's how I learned, with no tabs. But some people say that it makes it easier. I've never gotten into tabs. So it's a personal thing, I guess. But yes, always make sure that you just review what the certification is going to be covering, and then just go from there. Okay, next question. I have a question. Whichever AAPC or AHIMA, once we get to be members of these, are we supposed to take some courses to keep ourselves updated? So do you have any recommendations, or what are some popular courses which we should take for being useful to us in long term, as students cannot decide so many options? Thanks. Okay, before I answer this question, here's the thing. When you guys are sending in questions, I strongly recommend that you get into the habit of writing complete sentences that are written very well. Because yes, a quick question, you don't have to use punctuation if you don't want to, but getting into like long questions like that, and you're trying to get to the source of the question, which is, I guess, if credential people need to continue to educate themselves, yes, that's why we have continuing education units. Work on having good sentence structure and writing in good English, because you're going to need this when you get into the real world and you have to send these providers emails. Don't start, well, I'll do that when I get, no. Get into good habits now. This is going to set you up for success if you start getting really good with writing. It is absolutely about writing as well. Well, no, it's just the coding. No, not so. Being a good high caliber medical coder, which is something that I always recommend for people that you should strive for. Strive to be a high caliber medical coder. Don't strive to be just a ho-hum regular coder, okay? You want to be that high caliber coder. You want to be one that is in demand because you are very good at your work. So that is why getting into these good habits now, good speech, good writing is going to be key. And even when you are in the student phase and like in the school phase, get into good habits of speaking well. Don't apologize for asking questions. Be very direct with your questions. Try to get to the point and use the fewest amount of words possible. Because when it comes to talking to providers, which eventually you may have to do, they're going to want you to get to the point very quickly. So that is something that I'm telling you guys now. Get used to it now. And when you send questions, make sure that you're writing them very clearly. From what I can gather from this, they're asking if a coder has to continually educate themselves. Absolutely. Every credential is going to require you to have what is called continuing education units in order to maintain this credential. Now that means, and it varies by association, it varies by whichever credential you have, okay? And it varies by the number of credentials that you have. So there's a lot of factors into it. But you can take things such as like HIPAA classes, and that can count as continuing education units. It will let you know whenever you do sign up for these additional classes, it will let you know how many continuing education units, how many continuing education units this particular class is for. So sometimes it is offered through the employer. Sometimes you have to pay for it out of pocket, but this is the cost of keeping up with a credential like this, okay? So next question, is certified health records specialist do the same job? Again, we need to work on sentence structure. But they're talking about the Certified Electronic Health Record Specialist, and that is through the National Health Career. I always want to say healthcare, but it's National Health Career Association. Guys, I will tell you this. If a credential that you are sitting for is not from the American Health Information Management Association or the American Academy of Professional Coders, there's not going to be very far you're going to be able to go with it. The reason that I say this is this, or the reason that I say that is this. When you are looking to be a medical coder, if you want to be a competitive medical coder in this environment, everybody is looking for AHIMA or AAPC credentials. They are not looking for these other credentials. And for this, the Certified Electronic Health Records Specialist certification, according to the website, this program teaches you the skills needed to keep patient data and health records secure for the doctor's offices, hospitals, clinics, urgent care providers, and other healthcare facilities. This is standard part of being a new employee. They're going to teach you about their electronic health record. This is at every single facility that you go to. You do get training on how they work their electronic health record. Why they have this, I'm not really sure. I don't really know anything about this. All I know is that if you want to be a medical coder, you need to be with AHIMA or AAPC. Those are the credentials that they are looking for. As far as this other thing, I don't really know what they do. But I know that if you are working in an office, they are going to give you training. So, I mean, is it going to give you heads up training? I don't know. Again, this is not something that I have seen or have a lot of experience. Or when I'm doing the job listings explained videos, I have not seen anyone asking for this credential. So if you want to work in medical records, you do not have to be certified for that. If you want to be a medical biller, you do not have to be certified for that. If you want to be a medical coder, you have to be certified for that. Okay, so that is just my thoughts on that one. Next question. On an application, when asked, what is your unit/specialty preference? Unit will be inpatient or outpatient. Specialty will be clinical or surgical specialty. So I would say that is pretty well on. Sometimes when they're asking what is your specialty preference, like they mean like orthopedics, podiatry, gastro, cardio, things like that. When it says something like that on the application, I strongly recommend that you guys say open. You want to be open to any experience that they have available for medical coders, because your job, especially as a brand new medical coder, is to get a job. And yes, there is a lot of, well, we want experience. But they are sometimes willing to hire brand new medical coders if you show that you can pass their initial assessment, which a lot of times they will give you like a test to see where your knowledge base is. How much medical coding do you know? And if you do really well on this test, they may call you in and say, well, let's talk, because we need somebody that's certified and we haven't been able to find qualified candidates. So we may take a chance on somebody brand new. It doesn't matter if they're asking for experience, you always still apply anyway. And that is one of my strongest recommendations, is that you don't take no for an answer. If they're telling you that they want 3 to 5 years experience, go ahead and apply anyway. That's just my advice on that one. But yes, just put open and be willing to accept any assignment that they give you. The more excited you are about what you could possibly be doing, the more they're going to want you, because of the simple fact that you're not going to pigeonhole yourself into, well, I've only done physical medicine and I only want to work in physical medicine. Well, what if they don't have availability in physical medicine? Then you just got passed over for somebody who said that they were willing to do anything, any clinic. And you should be willing to do any clinic, because the more clinics that you have exposure to, the more well-rounded you are going to be. And the more well-rounded you are, the more opportunities that you're going to be able to have. So just something to think about, guys. All right, next question. Is your day mostly at a desk on a computer, or do you interact with patients? I have never interacted with patients, ever. Medical coders do not have any interaction with patients. The only ones that have the interaction with patients is the billers. So if they have like a dual responsibility of medical biller and a coder, then sometimes you will have to talk to the patients. But if you're doing just the medical coding, then no, that is not what we do. Our interaction, it lies with the providers and the ancillary staff. That is where our interactions come into play. But other than that, no, we do not talk to the patients at all. Okay. Next question. Do you take phone calls? My phone occasionally rings, but usually if my providers need me, they will come to my door. They don't usually call me. So, because my office is embedded in the clinic. So, and even being at home, when I was at home, during the start of the pandemic, they never called me. So it was always by email. So it just depends. Some providers like the phone, some don't. So it depends. Next question. Is it necessary to take an anatomy course, or can I learn it from other resources without having to spend $700 for a course? So what this viewer was talking about was the additional course that you have to take with AAPC. They do recommend that you do take an anatomy course before you get into the medical coding course. And they are absolutely right on that, because of the simple fact that when it comes to medical coding, you have to know medical terminology. Medical terminology does not necessarily mean that, oh, I got to know all these procedures too. Medical terminology is going to be the gateway. In order for you to even understand what you are reading in the procedure notes, in the clinic notes, in the inpatient notes, you have to understand medical terminology. That's going to be the only way, because otherwise you're going to be sitting there looking at all these big words, or these words that just don't make sense to you. Now, with medical terminology, a lot of people get overwhelmed with the amount of words they have to know. Do you have to memorize thousands of words? Guys, no. You need to concentrate on learning your prefixes, your suffixes, and your root words. Because when you know those three parts, you can be able to put lots of words together. And that is the key, because you're not going to have to know thousands of words. And you're not going to have to know their meanings. But you are going to have to know, when you look at it, oh, well, I know that osteomyelitis is the inflammation of the bone. That you can tell by looking at the word. Osteo means bone. Itis means inflammation. You put them together. Osteomyelitis. So that's the thing that you have to understand. And just being able to quickly put that together, that is another thing as well. So esophagitis. The esophagus is inflamed. Esophagio and then itis. The esophagus is inflamed. So that's that. That's how you're able to put those words together. So yes, you know what it means. Okay. And if you have to look it up, then you have to just look it up. But those are the things that when you break things down into manageable little blocks, it is a lot easier. And it does become a lot better to be able to grasp a lot more, because then you're going to be making lots more headway, rather than just, I have to memorize this word, this word, this word, this word, this word. It doesn't, I mean, that's not going to help you. When we were kids, remember, you had to go to kindergarten and you learned your letters and you learned your numbers. And then when you started going to school, you started learning how to put those letters together into words, and you started to learn to read, right? But they didn't expect you to start reading like right out of the gate. They didn't expect you to start learning how to do math right out of the gate, right? No kid in kindergarten starts off doing algebra, okay? They start learning the numbers. Then they start learning to add as they go on in school. So that's the thing. You have to think of it that way. You're learning something that it takes doctors years. Doctors get years. They get 10, 15 years. Some get 20 years if they're a subspecialty, and or up to, right? Because they get done in less time than that. But they're always learning. And that's the thing. With medical coders, we get like 9 months, 12 months, 18 months. And then we're expected to be medical coders. This is why we have to continue to study, because there is so much to learn. We have to know, as medical coders, the same things that doctors know while never having gone to medical school. It's a lot. It is a lot. And still, you have to learn anatomy and you have to learn medical terminology. And this is not negotiable. Knowing anatomy and medical terminology is not negotiable. You have to know this in order to be able to select the correct codes. Because there's going to be alternative wording that you're going to have to know when you are looking at these words, because not every single way that a condition can be written is going to be the same as it's in the book. So you have to be able to learn those synonyms and what word can best describe this one if I can't find it in the book. So it is a lot, guys, but it's not impossible, and don't let it overwhelm you. This is the biggest challenge that new coders face, is this part right here, learning medical terminology and really being able to understand those things and anatomy. But yes, absolutely invest in that. It is worth it. I haven't been through AAPC's programs at all, so I don't know like their structure of their programs. All I know is AHIMA. And at that, I didn't go through their online course. I went through a program, right? So it's worth it. It is completely worth it to have those classes because it will prepare you. I'm just saying. And the last question. The college has a medical billing and coding certificate program and a health science associate degree. Which do you recommend and why? So the thing about the certifications versus getting a degree. And health science associate, I don't know what that is because it's for AHIMA. In order to sit for the RHIT, which is the Registered Health Information Technician, I believe it's supposed to be the Registered Health Information, the Health Information Technician program or Health Information Technology program. So I don't know if that's the same thing, okay? And I know sometimes schools, they call it differently, but then it's approved through AHIMA, so I don't know. But when it comes to getting an associate degree or just getting a certification, if you want to be in a position of leadership, then you want to get the associate's degree. Now, the associates, the RHIT, that is more of like the supervisory roles. They do a lot of the audits and things like that. They do a lot of those types of tasks, but they are hands-on. They are more hands-on with the coding, all right? But if you are, hold on. Okay, that was a sneeze break. Okay, if you are wanting to be in a position of authority, like leadership and things like that, then you would want to go with the associate's degree. If you are brand new and you're curious about the medical coding field, then go with the certification, because at least this way you can test it out, see if you like it, and then if you like it, then invest in going to school and getting your degree. Because if you don't really know, or if you're not really sure, so many people have taken the degree program and like not even used it. I have known many RHIAs who have literally gone, that is a bachelor's degree, the Registered Health Information Administrator, and they don't use it. They literally don't use it. Well, I changed my mind. Did you even know what it was? Well, no, I didn't know what I was getting myself into, but I just took it because it sounded really good. So that would be my biggest suggestion to you, is to start with the credential. And the credential is just as good, okay? A lot of times, yes, in some of the ads, they are asking for a degree. Sometimes they say that they want a certification or they want the degree. If you have to pay for somebody to do this work for you, don't you think that it would be like, oh, okay, well, let me go ahead and get somebody who's been in college? But just because they've gone to college and have that degree does not mean that they have the same skills as somebody who's certified as a medical coder. Because a lot of times people who have degrees are not doing coding, or they're not heavy in the coding, like the production and all of that stuff. That's more of the certified coders. So again, it is going to be a personal choice, and that is my thoughts on that one. So I'm going to wrap this one up. But before I go, I am now on LinkedIn. So if you are on LinkedIn, I hope that we can connect, because I haven't ever set up a LinkedIn, and now finally I'm there. So I think I have like 18 people on my LinkedIn now. I don't know. But if you want, I'll leave my link for LinkedIn down in the description box below. I hope you'll tune in next time. Hit that like button and hit that notification bell too, guys. And if this video helps you, I hope that you will share it, because the more you share it, the more engagement my channel gets, the more people can be exposed to my channel. And I really do appreciate that, because at the end of the day, it is all about spreading the truth and telling people like what this field really is. There are so many people that are saying all these great and wonderful things, but they don't talk about the real talk. And I'm about the real talk, guys, because I'd rather you be prepared than not prepared, you know? So anyway, I will go ahead and wrap this one up. I will see y'all tomorrow. So if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.